Everyone, good evening. Welcome once again. In case you joined while we were just getting some things sorted, you're welcome once again to EHA Clinics Laboratory Academy webinar. And today we'll be having Marcel Kita to talk to us on laboratory leadership, management, and systems as our focus. I'm sure you'll be having a great time. Marcel will be coming up now. She'll be introducing herself and presenting to us all that she has to. Marcel, can you hear me? Can you confirm that you hear me?
Yes, I can hear you.
Okay, so let's see, try sharing your screen and then let's see that you don't have any issues with that.
Can you see my screen?
Yeah, confirmed, yes, it's up.
Okay.
All right, so you have the stage now, you can carry on.
Okay, thank you very much.
Yeah, you're welcome.
And I'm not able to put my video. It's okay for now.
Okay.
That's fine. I don't need to put the video now. Maybe when the question section comes up, we can put the video.
All right, yeah.
Okay, so hello everyone. Good evening. My name is Masere Keita, and I'm the Director of Programs at the African Society for Laboratory Medicine. So just a few words about ASLM. So ASLM is the African Society for Laboratory Medicine. It was established since 2011 in Addis Ababa to enhance professionals' laboratory practice, science, and networks in Africa. We work across 5 strategic pillars, which are laboratory networks, laboratory workforce, quality of laboratory services, data and communication, and regulation. Today, I wanted to talk to you about laboratory leadership, and I'm calling it systems and management because I wanted to focus on 2 areas. So laboratory leadership comes in various different forms. At the national level, there's been a push to establish laboratory directorates where a director of laboratory services sits. Other aspects of laboratory leadership are those who sit in technical working groups and have an understanding of laboratory systems and networks. Finally, you have laboratory managers who manage individual labs. Today, I will touch on the latter 2. At ASLM, we brought together the different directors of laboratory services of various African countries. And one of the things they mentioned was that we need more leadership in the laboratory space in Africa. I will present on what kind of leadership laboratory technicians can aim for and some opportunities to attain these skills. I don't know why my slides keep shifting. So laboratory systems are those horizontal concepts that need to be in place to optimize laboratory networks. Some examples of those are those that are around in the circle, which we have legal and regulatory framework, organization, partnerships, finance, human resources, and so forth. And the laboratory networks are those national lab pyramids that exist usually from the top tier of the laboratory where a national reference laboratory sits down to the community level where point of care occurs. Now, there's some essential normative standards for laboratory systems and networks that leaders should be familiar with. We have the WHO Maputo Declaration for strengthening laboratory systems in resource limiting settings. We have WHO IHR, International Health Regulations, which binds all countries to be alert and ready to respond collectively to public health threats across all borders. We have the WHO IDSR, which makes the best use of country resources to conduct integrated surveillance of priority diseases. And we have the FAO-OIE WHO One Health Concept Note, which is to prevent, detect, or respond to public health and animal risks through intersectoral collaboration. And then there's the GHSA, which is an international effort of nations and organizations to accelerate progress towards a safe world by speeding up the implementation of IHR and OIE PVS. So these are some of the standards and that need to, for laboratory leaders to be familiar with when they're thinking about systems and networks. Now, laboratory leaders that are able to make decisions on how to optimize lab systems and networks need to have the capacity to assess these systems and networks and then utilize the data to make evidence-based decisions. I want to highlight an assessment tool developed by ASLM that is a systems-based assessment that helps leaders identify key gaps and then develop plans to address them. It's called the LabNet scorecard. It's a matrix for scoring the functionality of national laboratory networks in Africa. Now, LabNet measures capability across essential functions of the laboratory system and network. These are 9 essential functions, and it uses a color-coded scoring system to reflect what level each laboratory network sits in terms of these different essential functions of the laboratory system and network. And then it gives you a visual to see where there are key gaps. And so the red colors and the black colors are areas that it either doesn't exist or it's very limited. So those are, it gives us a very good visual of what the key gaps are. And then what it helped us do? It helped us to identify and target interventions. For example, in this country, under the capability number 2 of structure and governance, realized that there was no tiered network that the tiered network did not incorporate diagnostic activities at the community level. So this would be one area where we have a targeted intervention. We also realized under priority diseases that there was no antimicrobial resistance prevention strategic plan. And so that's another targeted intervention that we recommended that the country develop an AMR strategic plan. Now, this scorecard methodology has been introduced in various countries, but we have a limited number of lab professionals who are able to use and interpret this assessment. So there's an opportunity here to grow the pool of LabNet scorecard experts. I'd like to highlight now 2 training opportunities available to you. One that focuses on systems and another one that focuses on networks. So we realized that there's a gap in leadership on building, strengthening, and sustaining national laboratory systems. Laboratory leaders must have the necessary skills to meet national, regional, and global disease detection and response objectives. There's a program called the Global Laboratory Leadership Program, the GLLP. And so the GLLP partners are a multi-sectoral collaboration of 6 leading organizations that target human and animal health laboratories, as well as laboratories with health impact. So environmental, agricultural, food, aquatic, or chemical laboratories. And the GLLP founding partners are APHL, CDC, ECDC, FAO, WOAH, and WHO. Now, the goal of the GLLP is to foster and mentor current and emerging laboratory leaders to build, strengthen, and sustain national laboratory systems. And the partner's mission is to provide laboratory professionals with the tools to develop their laboratory leadership competencies and advance effective national laboratory systems for improved health security using a One Health approach. And again, the target audience are really, a vast array of laboratories, so clinical, diagnostic, medical, public health, animal, environmental, or any other laboratories that are performing testing. GLLP program is based on the Laboratory Leadership Competency framework. And this framework is available to you online. If you just Google Laboratory Leadership Competency Framework, it will come up as a WHO document available to you. And it outlines essential competencies needed by laboratory leaders to build and direct sustainable national laboratory systems for disease detection, control, and prevention in health systems. And the 9 competencies are laboratory system, leadership, management, communication, quality management system, biosafety and biosecurity, disease surveillance and outbreak investigation, emergency preparedness, response and recovery, and research. The GLLP program is a program over 24 months. So it has specific training content that includes interactive didactic sessions and practical mentored laboratory experience with small projects between sessions. It has a mentorship period where mentorship at regular intervals throughout the program duration to support learning and professional development. And it can either be in person or through a relationship such as twinning. It has various projects to support learning and national needs. So small projects that are completed usually within the first 18 months of the program, and then a capstone project which is completed during the last 6 months of the program. And then beyond the 24 months period, there's community building. So there's activities within and between cohorts over time, between cohorts from other areas, and then network building and the creation of a community of practice. Those of you who are interested in the GLLP program, there's a website, there's a link below. It's a WHO link. And at the end of the discussion, we can maybe, put this in the chat so that you have it available to you if you're interested in finding out more about GLLP and how to participate. The other training program that's available and that focuses on networks is we realize that there are gaps in formal training and comprehensive overview and management skills for the coordination of a national tiered laboratory network. The lack of comprehensive training on concepts and methodologies for network improvement hampers the advancement of laboratory services as a whole. So ASLM, Batos, Find, and Chai, we all came together and we developed a course that we call LabNet Lead, Laboratory Network Leadership. The goal is to build the capacity in leadership and management through the provision of practical training and group work tailored towards optimizing the country's laboratory network. Aims of the course are to introduce concepts and activities essential to adequately design, optimize, lead, and manage functional, high-quality laboratory networks. And so at the end of the course, participants should be able to explain the importance and potential benefits of a functional and well-coordinated national laboratory network, contribute to the development and optimization of the laboratory network in their home country using evidence-based approaches, contribute to the implementation of the tiered laboratory networks planning cycles, such as preparing, implementing, monitoring, and evaluating laboratory policies, strategies, and action plans, and manage and supervise the laboratory network in their own country using appropriate soft skills. The structure of the course is over 6 months period where it's a 5-phase course. So the first phase is through individual assignment where we're giving literature reading and written assignment. Then phase 2, you have a face-to-face training over 5 days that introduces the laboratory network, and it introduces the LabNet scorecard assessment tool that I had started this presentation with, as well as communication skills. And then you have a group assignment over 2 months which is assessing the national laboratory network using the LabNet scorecard that I had introduced. And then you have a face-to-face training for 5 days, where you go over network design and optimization and management and leadership skills. And then the final assignment is a 6 months period, which is to develop and implement a smart operational plan to improve the national laboratory network. Delivery of the course is through the ASLM Academy platform. It's facilitated by experienced ASLM trainers, and the material is currently available in English and soon to be available in French. Now, to apply, interested countries should submit a letter from the Ministry of Health supporting their participation in the course, and they'll identify its members of the National Laboratory Network or similar and other potential participants. And if you want more information about this course, you can contact Dr. Collins Otieno, C. Otieno at aslm.org. He's the lead at ASLM for this course. The other form of leadership are those managers that lead individual labs. Usually these managers are selected amongst technical staff and placed in a management role. Unfortunately, what we see mostly in Africa are many of these managers are ill-equipped to manage these individual labs because although they have good technical skills, they often lack the business management skills required to effectively manage a lab. So laboratory facility management has as its goal to guide laboratory personnel to deliver their assigned duties within limited time and resources, including acquiring grants, personnel, equipment, or the necessary tools, designing the workflow, overseeing the daily operation of the plan, and training new lab personnel. Lab management really involves certain lab keeping chores such as maintaining instruments, restocking consumables, scheduling, giving technical advice, and keeping records of certain lab activities or incidences in the lab. What do laboratory managers do? They do a lot. So, there's the whole management aspect, which is really to ensure compliance with all regulatory requirements. You have operations, which is monitoring inventory and ordering supplies as necessary, scheduling laboratory and equipment time for staff, acting as a liaison between staff and key stakeholders. And then you have training, which is really to ensure that all the team members have been trained to use the laboratory equipment, software, and supplies safely and efficiently. You have the oversight of safety, where you update the lab safety plan and safety data sheets as necessary, and then you schedule safety training for new hires or team members entering new roles. And then you have the maintenance, which is really overseeing the cleansing and sanitizing of the lab, ensuring that all equipment and instruments function correctly, and initiating repair and maintenance of said equipment as necessary. Laboratory manager's strategic roles include setting lab objectives, designing long-term plans, overseeing lab operations and relevant regulations, assigning tasks, monitoring and evaluating staff progress, performance, and customer satisfaction, developing and administering the budget, and reviewing regulatory requirements. So to be an effective laboratory manager, you should have a different set of skills. So these include analytical skills, which are to analyze and evaluate, the management skills, which are really the planning, prioritizing, decision-making, delegation, and problem solving, and then the interpersonal skills, which include communication, coordination, and negotiation. So how do you become a laboratory manager? First, you have to know what are the requirements in your country. You have to complete the relevant education. You have to meet the licensure and certification requirements that are relevant to your country. You have to gain experience. And then you should research some of the different lab management training opportunities that are out there. There's a lab management in practice training that's available online, some laboratory management online courses, and others offered through South Africa. Unfortunately, these are usually paid courses, unlike the former two training opportunities that I mentioned, the GLLP and the LabNet lead, which are free. These other courses for lab management tend to be ones that you have to pay for. Now, as a woman with having had the opportunity to be in a leadership role in my organization, I wanted to highlight that we need more women leaders in the laboratory space and in healthcare in general. So women make up about 70% of the healthcare workforce, but only 30% of women healthcare workers operate in senior roles. As we know, women face unique challenges in attaining leadership roles in healthcare. There's the work-life balance issue, there's societal norms, particularly in Africa, that place the woman as the primary caretaker at home. However, having women leaders is important for providing high-quality patient care, reducing gender bias, and ensuring equality and representation in the lab. Us women have unique attributes that fulfill needs that are gaps in healthcare leadership positions. So I urge all the women listening to really seek for leadership positions. And then my last slide is really to give ways that women can become leaders. And it says women, but I think this is interchangeable. It's also applicable to men. So if you're looking for a leadership position, you should identify a mentor to support you, a mentor or mentors to support you. You should define a process towards leadership. So a personal, professional advancement document with time-phased goals. You should gain the expertise and knowledge required. You should seek other women leaders for advice and guidance. You should build professional relationships with other leaders in your institution. You should always be helpful and demonstrate leadership in solving important problems in your department or organization. And then you should ask for additional experiences to prepare and position yourself for greater responsibilities. Thank you very much.
Yeah, thank you, Marcel, for that very sharp and straightforward presentation on lab leadership. Um, I guess we'll give opportunity now to questions. I don't know, are there questions in any areas we're unclear of or we need further clarification? Mercer is holding on for our questions. I'm checking the Q&A box now. We do not have any questions yet, but I hope we got the presentation. Um, the national level leadership and then the leadership at smaller laboratories. So I'm sure there may be some of us who are aspiring, and she gave particular particular bias to women. She said about 70% laboratory staff sometimes are women, and then just about 30% come up to leadership roles. And she gave us some tips on how we can aspire, believing that okay, everybody can have a level playing ground. So are there areas that we think we need further clarification? I guess she'll be willing to answer our questions. Okay, I think I see one. So what are the key qualities for becoming a laboratory manager? This is EC from Lagos. Okay, so I guess it's just more of highlighting what you had already said. Maybe the other aspects apart from the technical qualifications that they may have already acquired while working on the bench. So Marcel, that was a question we have for you. Can you just say a few things? Thank you.
Yeah, so I think that, as I was saying, in Africa, we tend to take people who are technically skilled and place them as a laboratory manager. But what we're missing and we're seeing is that there's a lack of business management skills. And that is really important. If you're going to manage a facility, you need to be able to do budgeting, you need to be able to do forecasting, estimating the costs of how much it costs to run your laboratory. You need to have skills in terms of HR skills to be able to identify the right people to work in the laboratory and train them. And so there are a number of skills that I think, we tend to overlook, where we think the technical skills are the most important for a laboratory technician to know. But if you're really aspiring to become a laboratory manager, you should really look at improving your business skills as well.
Wow, that's really lovely, because what you're saying is a reality of what's going on truly. Yes, usually we pick someone from the bench, someone who has maybe distinguished himself one way or the other, and make him a leader, a manager of the lab. But then uh, in practice, you find out that a lot more is required of this manager. Okay, and I think while you were presenting, you mentioned some other, you talked of the GLLP platform, where we can have some free courses, and then some online courses from the LMIP, but they are paid courses. Are the other ones you can just suggest to us, if you know, so that uh,
There's
our listeners?
yeah, there's a group called Lab Vine. So LAB
Okay.
Lab and then Vine,
Yeah.
VINE. And they tend to
Yeah.
list a number of courses that are available for laboratory management, as well
Mm,
as universities in South Africa. Stellenbosch University offers a lot of laboratory management courses.
okay.
Yeah. So those are some of the ones that I know. But again, there's a whole bunch of them available online, and they're
Yeah.
offered at different times of the year. So
Okay. Okay. And then somebody said, how do you overcome? This is Bolahong Kabiao. He said, how do we overcome challenges of laboratory funding by CEOs? So sometimes you have this perhaps brilliant ideas and possibilities to break forth into other areas, but then you have not so encouraging CEOs. What do you think are the options of the lab manager?
well, I think for one thing, a lab manager, if you're able to make a really good forecast and estimation of the costs, and I think we've seen that a lot in many countries. We ask lab managers, they order supplies, but we ask them how many of these testing toolkits will you need, how many, and they're unable to say it based on data, based on evidence. So really, I would stress that one of the things is really to collect data on your needs and provide estimated costs that would prevent waste at the end of the year. Because sometimes you have CEOs and others that are reticent because they say, we bought supplies and they expired. And, so in order to really forecast properly, that's one of the ways you can do it. And to advocate for that with your CEO.
Mm,
Use data
yeah.
to drive your decisions.
Mm. That's a beautiful punchline there. Use data to drive your decisions. Bolaho, I hope you got that. So her advice is to use data to drive your decisions, because these business owners do not want to run at a loss. They are there for profit, and they wouldn't want to buy kits that will get expired before they are used up to generate, back the capital that has been invested back in them. So we should start with forecasting what really is needed, so that we can um, judiciously use the available resources. And I guess once the CEOs begin to see more of this good judgment and decisions, they will of course give the much needed support every time we request them. So are there more questions? Somebody said, can someone from another field take up the responsibility of laboratory management and still do well? That's if the person is, I guess this question means the person is not a laboratorian, perhaps. Is it, can someone from another field take up the responsibility of a laboratory management or manager and still do well? What do you think?
Well, I think that, as I outlined as what are the roles of a laboratory manager, one of the important roles is really to be a leader to the other laboratory technicians and to train them. So you need to have skills in laboratory techniques. Otherwise, you're not going to be able to train your staff, and there are a lot of things that you will miss. So I've not seen in any of my experience where a laboratory manager was someone other than a laboratory technician. It's easier to take a laboratory technician and teach them management skills than it is to take a manager, a business manager, and teach them laboratory skills. So, I don't think that someone who's not in the field will do as well. But I'm sure there are some examples out there where they have some business people running labs, but they're not as sensitive to the needs of the laboratory technicians, and you're not able to train them on the bench.
Yeah, thank you very much for that. I guess we're learning. It seems like so much more is coming out from the questions than the presentation. I think the practical application of it. In fact, I'm finding this aspect much more interesting. So, Bernice, I hope you got that answer. Because some people are asking some questions that shows that okay, you actually perhaps did not participate. So somebody is still asking what makes a good manager. I think that has been answered. You must be able to. So this is not just a good manager, but a good laboratory manager. I hope we understand that the scope is within laboratory. And so one of the things I think I'm picking from what Marcel is saying that okay, so a laboratory manager though has the technical skills because part of what is required of him is to train other technicians on laboratory aspects, but then he also has the responsibility to develop business management skills, which will involve things like budgeting, forecasting, then even identifying the proper staff to be hired. That's some HR skills. So these are some of the things. So is it please, can you highlight more on some of the soft skills? Okay, someone is asking, this is, I think this is Emanuela. Is that, can you highlight more on some of the soft skills and certifications expected of a laboratory leader globally?
Mhm.
All right.
Okay.
Mr.
And
You
I mean,
got
I can
me?
answer that question as well as the one just before it, where they say, where do you handle this? How do you handle a situation whereby a laboratory manager's advice is not heeded? Basically, some of the soft skills you need to have are really what I had highlighted are good communication skills. You should be able to communicate at an effective level. You should be able to negotiate very well. And then the certifications are really hard to. U.S. has specific certifications. Nigeria has specific certifications, and I don't know them all. But depending on the country, you would have to look up to see what are the required certificates. South Africa has certifications. They're all different. Even the level of education needed to be a laboratory manager differs from country to country. Some countries require PhDs, other countries take them at master's level. It really depends. So if you're interested in becoming a laboratory manager in a particular country, you would have to just research what are the requirements there. But the soft skills needed are really important: communication, negotiation, and planning, being able to plan and being able to lead by example.
Okay, yeah. So I hope you got that. Is that Emmanuel who asked that question? So soft skills has to do with negotiation, communication. Of course, the relevant license shows that our local country will need for us in Nigeria, the Medical Laboratory Science Council of Nigeria licenses us to practice, and that's what we need. Somebody say, can a pathologist be a laboratory manager? From what we're seeing, I hope we're following so that we don't keep asking the same questions. Okay, so it's not necessarily, I think, your primary bias, but that when you have technical skills, you should have managerial skills too. I think that's what Sarah has been saying. Um, Okay, so someone is asking this, is that how can one undergo the GLLP training?
Okay, for the GLLP, there's the link. Let me put that in the chat where
Okay,
you can have more information on how to. It is, I think, by invitation only, but let me go ahead and place the link in the chat here.
okay. Okay, so let's see other question. What collaborative opportunities are available for mentorship in both technical and research areas in your average? Okay.
Okay, and that will give you more information on where.
Okay, so what?
Mhm.
Okay, please.
I don't work in a
Okay.
particular laboratory,
So
so
guys, we have the link.
for that question, what collaborative opportunities are available for mentorship in both technical and research areas in your laboratory? I don't work in a laboratory. I work for the association. This is the African Society for Laboratory Medicine. It's an association. And so we cover the needs of lab professionals and we have memberships, but we can maybe identify a laboratory to mentor you if you're interested. I will go ahead and put my email address as well so that you have that available to you.
Okay, that'll be nice. Okay. I think you've answered this question. Say, how do you handle a situation whereby a laboratory's manager's advice is not heeded?
Mhm.
So I guess you said something about negotiation, good communication. That's where the soft skills comes about, you know. And then, of course, your good judgment in the past, like she talked about having to forecast and forecast rightly. You're not making the organization put in money in kits that gets expired before they are used up. Investing in investigations that are not yielding. So I guess those are areas where your advice will not be heeded. I'm not sure any business owner is not there to make profit. So if your suggestions would cause them to make profit, why not?
Exactly. You need to be able to translate scientific data into data that you can relate to business owners because
Mm,
our CEOs are business owners. And
mhm.
so translate the data so that you can talk to business owners.
Yes. Okay, so I saw one more question. I think we'll be around. She said the prospect of laboratory revolving fund has been proposed with very little support by the CEO. Why is not embraced the drug revolving funds? I'm not sure. I get this question now. The, Marcel, did you see this question? Does it have something to do with what we shared this evening?
Yeah, I'm not sure I can answer that question. um,
Yeah. So the next is how can laboratory managers overcome the challenge of poor laboratory equipment in I think these are very peculiar questions to
Yeah, and
um,
again, like I said, this is where you need to collect the data and you need to inform them what's poor about the laboratory equipment and what equipment would be better and find ways of finding cost-effective equipment that could replace that.
yeah, yeah. Okay. Um, I guess we're given we're given time for many questions because your presentation was very short and precise. Ordinarily, but I guess the questions too have brought in much more light. We've used that to squeeze out more experience from you.
That's fine. And I will
Fine.
send you a copy of the presentation so that you can share with your constituents. That's fine.
Yes, please. We would really appreciate that. Thank you, Marcel. Any last words? Any final words? Because we have I'm sure we have a few laboratory managers here, and then we have most others who I would prefer to use the word in this case, aspiring lab managers, right? Either
Yes.
who have never thought of it but will think of it by the push you've given, like the ladies who you spoke to directly, and the guys who are not offended but will take will take the challenge. And so, are there any last words, any final words you could just add to what you've said this evening?
Just to say that, we have a very talented pool of laboratory technologists on the continent, and I know in Nigeria we have many skilled laboratory workers, and I think that everyone can aspire to be a leader. Like I said, hone skills that are technical, but also hone skills that are managerial. Learn even for yourself to be a better laboratory technician and to be able to help your leadership make good decisions, evidence-based decisions, collect the data and present it to them in a way that they can then argue for improved laboratory infrastructure for you and everyone else working in the lab.
Okay, thank you very much, Marcel, for those words. Thank you for every push. I hope there are no questions. Okay, yes. So thank you, Marcel, for your time. We really appreciated how sharp and how you've pushed us. I guess that there are quite a lot of things that we have picked here, and even the suggestions for the online learnings we can avail ourselves. The University of I think University Stellenbosch University in South Africa, and the online programs that they do. Yes, I know of LabVine. I've done a couple of courses from LabVine. So I guess everyone has heard some of the things here. So for those of us who joined for the first time today, please, I shared the WhatsApp link for us. This helps us for better communication. I'm just posting it again in the group, so kindly click on it and join. And then we're doing a survey. We just want to have information on how best we can serve you better. So that's why we want to do this survey, or we're doing this survey. So the link is also dropped in the chat section. So just avail yourself and grant us the information. Thank you, Marcel, once again for your time. I hope you'll be you'll be warm to receive our request once again to give us a push on this topic. And I guess the ladies, you have so much to thank her for, that the space is open for every one of us. We can all aspire to be leaders in our spheres, and we can push and not just be the best at our technical skills. Today we hear that to be an effective laboratory manager, we must also think outside the box. We must go and consider other things like business management courses, budgeting, forecasting, HR skills, and then improve our soft skills that has to do with communication, negotiating, and then let your data speak. If your CEOs are not listening, let your data speak. Help them not waste a lot of money. Thank you very much, Marcel, for your time once again. We're glad to have you.
Thank you. It's been my pleasure. Thank you so much for having me.
Yeah. Yes, please. So for us at EHA Clinics, this brings us to the end of this webinar this evening. And of course, we'll always be bringing something fresh and nice again. So in November we'll be having also another very interesting webinar, still hosted by EHA Clinics Laboratory Academy. We are ISO accredited, and you can just get any information from us. I myself remain Obina Marizu, who is your moderator. Thank you very much, and do have a good evening, everybody. Bye for now. Bye, Marcel.
Bye. Thank you.
Yeah, bye.